Hey guys, so unfortunately during this time period we don't have access to a mannequin in the simulation lab, so we won't be able to demonstrate how to properly insert or remove a catheter from someone. However, we decided to film how to prepare the catheter kit and get it properly ready before inserting it into your patient. So, obviously your first step would be to go to the supply closet and grab your Foley catheter kit. As you can see here, the kit will have everything you need, including the Foley catheter, a 2,000 milliliter drainage bag, a bed sheet clamp, a pre-filled syringe with sterile water, a pair of vinyl gloves, a waterproof drape, swab sticks, lubricating jelly, and lots of other stuff that you can see here on the list. So for step 2, you would obviously want to go into your patient's room and introduce yourself if you haven't already. Verify your patient by their name and date of birth and reestablish if the patient has any allergies you need to be aware of. Then perform hand hygiene while you explain the procedure to your patient. Use a blanket to maintain client comfort and position the client supine with their knees flexed. So the next step would be to begin opening the kit. It is surrounded by a plastic wrapping that many nurses like to use as a trash bag by the bedside, and they put all the trash collected during the procedure in there. So around this kit is your sterile field. You have 2 inches to grab around the edges of the wrap paper so that you do not contaminate your sterile field. So you carefully pull each side of the kit until it is all open and flat on the table. You are now exposing the kit and everything inside of here is sterile. For step 4, you are going to want to place a waterproof drape underneath the patient between their legs for the procedure. This will help keep their bed linens dry. The next step would be to put on your sterile gloves. It is crucial that you maintain your sterile field during this step, so pay close attention to the correct way to do this. You will take the package that contains your gloves and lay them next to your kit unfolded. Place your fingers underneath the flabs to pull them open. Remember, you have a 2-inch area around the border that you are allowed to touch to keep a sterile field. Now the gloves are exposed. You will want to glove your dominant hand first. If you are right-handed, take your index finger and thumb of your left hand and grip the bottom of the glove that is folded. This is the inside part of your glove, therefore you are not contaminating the sterile field. Begin pulling the glove toward yourself as you are sliding your right hand into the glove. Keep the thumb tucked in so that it is easier to slide on. Take your fingers and pull the glove as high up your arm as it can go. Now the gloved hand is sterile. Do not touch anything other than this glove and the inside of your working area, or else you will contaminate your sterile field and have to restart the entire procedure. Now you are going to glove your left hand. Take your right gloved hand and go underneath the cuff. Instead of grasping the bottom like you did before, you are going to go underneath it to maintain sterility. Hold the glove up. Slide your left hand into the glove while pushing with your gloved hand until you are able to pull the rest of the way to get your hand all the way inside the glove. And now you have your sterile gloves on. Step 6 would be to place the sterile drape over your patient to protect the sterile field. The small opening will be placed over the patient's private area for you to be able to insert the catheter. The next step would be to prepare the povidone iodine solution, which is a broad-spectrum antiseptic for topical application that is used to cleanse the perineal area and prevent infection. In some kits like this one, the solution is already prepared on 3 swab sticks, so you just have to rip off the top of the package and set it aside until you are ready to use them. However, in other kits, they will provide cotton balls and you will just pour the liquid onto them. This is your lubricant. This is what you will lubricate the Foley catheter up with to make it easier and more comfortable for the patient when you insert it into the urethra. This is your pre-filled syringe of sterile water. It is used to inflate your bowl before you insert a Foley catheter because you always want to check to make sure it is working properly. There is a specimen cup inside the kit. A lot of doctors will order you to insert the Foley catheter and then get a urine specimen, so you would use this. So below your kit is the Foley bag and catheter itself. Right here, this is the part that will actually go into your patient. You'll want to keep the plastic wrapping on the catheter until it is time to lubricate. This port is where you insert the 10 cc of sterile water syringe to inflate the bulb, and then this port right here is where you would stick a syringe to obtain a specimen of urine. After you insert your Foley catheter, there are these 2 little holes right here. Once the catheter hits the bladder of your patient, it will start to fill with urine and the tube will turn yellow. It will collect the urine and gravity will help it flow down into the bag. Step 8 is to inflate the bulb of the catheter with sterile water to make sure that it is working properly before inserting it into your patient. First, you would pop the cap of the syringe off. Then you are going to connect the syringe to the correct port. Make sure it is on nice and tight. Next, press down on the syringe slowly and watch your bulb inflate. Wait 30 seconds as you look for any holes or leaks. Then, you will deflate the syringe by just letting go of the plunger and the water will suck back into the syringe. You can keep the syringe connected to the port for insertion. The last step to prepare your Foley catheter for insertion is to lubricate. You will tear the package open and squirt the lubricant into the tray. Take the wrapping off of the catheter and twist the Foley around to lubricate it thoroughly. Then place it back in the box to maintain sterility. Next, you would collect your kit, bring the box to the bedside, and set the kit on your sterile drape and proceed with the proper steps to insert the Foley catheter.